Hi, we are live now. Hi, friends. Happy weekend. I trust you all are doing absolutely fantastic. We are back again with the hernia session, which will be a conclusive hernia session by our friend Dr. Vishal Soni, laparoscopic and GI surgery specialist and a hernia enthusiast. So today, Dr. Vishal is going to answer questions pertaining to how to avoid getting a hernia, basically guiding us on what and what not to do to ensure you don't suffer from hernia. So Dr. Vishal, I'll straight away start with the first question, as you love keeping the sessions short and sweet. So we'll just continue with the same trend. So I'll start with myself. Now, I'm fat. To make it sound more polished, probably I'll use the word obese, which most of our medical fraternity friends use. So if I decided to jump onto a weight loss regime, how can I ensure that I do not land up myself in this great thing called as hernia?
Okay, I'll answer that question of yours. Actually, you have asked two questions in one go, and I'll be answering them separately. So first of all, Himanshu, thank you so much for inviting me for the second part of the three-part series that we are doing about the hernia thing. For the viewers that are joining us for the first time, a very warm welcome to all of you. If you have missed our first session, there will be link in the description and you can see the first video as well, where we've touched upon the details of what exactly is hernia all about. So as I was having a discussion with my good dear friend Himanshu regarding what next in the hernia after understanding hernia is how to prevent hernia or how to go about so that you do not get hernia. Now that is what the session today is going to be all about, the preventive strategy to ensure or to make sure that you do not get a hernia to begin with. So I have divided my today's talk in a lot of threes today. So we'll start with the three pillars, as I call it, three pillars of the preventive strategy for making sure that you do not develop a hernia. The three pillars would be, number one, correct exercise and correct form of yoga. The second would be to ensure that your obesity is in check and your weight loss regime is correct. And the third part would be absolute avoidance of smoking. I would be talking in details regarding the same. So Himanshu, as you mentioned that you want to lose weight and you want to make sure that it's in the smoothest way and you want it to be safe. You would be surprised to know the number of patients that I have seen in past few months or weeks here who got very enthusiastic with regards to exercise. There is a lot of fit India thing going on. So one fine day, people would get up and they realize that I wish to be fit, I wish to have six-pack abs, and they start doing crunches, so on and so forth, exercises. But let me tell you, it can actually be more detrimental. It can actually cause more harm than benefit, and in rare cases, can also cause hernia. So exercise and yoga are very good form to strengthen your muscles and give strength to your ligaments. But it takes its own time. It has to be a gradual process whereby the strengthening occurs. When people become over enthusiastic and they do not have a trained professional around them, they would probably see some YouTube videos, they'll see some blogs, and they'll start applying the same to their exercise regime. They more often than not end up having some form of muscular injury, some form of groin pains, that was what we've seen, and very rarely acute herniation. So it is very vital to know that correct form of exercise and correct form of yoga is very vital to ensure that not only your weight loss or your fitness is kept in check, but also that you do not develop a hernia. The second pillar that we'll be talking today would be regarding the management of obesity, as you just asked. Now, obese patients are at least one third more likely, like 30% more likely to develop a hernia as compared to the general population. Now, why would that happen? So, the fat deposition that we see exteriorly on the external, something very similar happens even inside their body. Therefore, the intra-abdominal pressure keeps increasing, and that intra-abdominal pressure in the tummy pushes the organ out and can lead to hernia. Similar fat deposition also occurs in the muscles of the abdomen. Now, thereby, the more fat is there in the muscles become weak, they become thinned out, and the organ gets pushed out through a thinned out muscle. The third issue with regards to obesity and hernia is that small hernias are very difficult to be picked up in cases of obesity. They'll be not very visible. The fat pad would make it very impossible to palpate or to have a visual clue with regards to a hernia. And thus we see that these patients end up having a large hernia, which is a very big challenge, not only during the surgery, but also they have an increased chance of recurrence. So a weight loss management cannot be a very simple thing that can be done easily. It requires specialists and at times also a proactive evaluation if the patient has a hernia to begin with or not. The third pillar that I'll be talking about is smoking. Now, how much of smoking is okay? No smoking, no smoking, no smoking. It will be a very surprise to know that there are more than 1,500 chemicals that are present in the smoke of the bidi or the cigarettes that patients smoke. Now, a lot of these chemicals, they have a property with which they inhibit the healing process in the body. That healing can be any healing in the body. The normal muscle wear and tear that happens in the abdomen muscles, for example, it's healed on itself by the body. But because of these chemicals that are present in the smoke, this normal healing process is not good, whereby a long-standing smoking can give rise to chronic muscle injury and therefore hernias. Of note is that chronic smokers also suffer from constipation, and that is one of the trigger points with regards to development of hernia. So when I talk of trigger points, there are more three trigger points that one needs to take care of, along with the pillars of prevention strategy that we just talked of. The one would be chronic cough, a long-standing cough of any cause. It needs to be promptly and it needs to be completely treated to make sure that the tummy pressures don't increase and herniations don't happen. The second trigger point would be when you are having a difficulty in passing urine. We very commonly see this in our patients who have an enlarged prostate, which is as such a normal phenomenon as per age. So increased pressure that one needs to generate for passing urine can give rise to increased intra-abdominal pressure and thus can trigger a hernia. The triggering point that I would like to highlight is constipation. Straining at stool for a long period of time cumulatively works with the other factors and can trigger hernia. So coming back to your question, if you don't want to develop a hernia, and we know that you are a little chubby, which is totally okay, it looks nice.
That's being nice and kind to me, actually.
So you need to be away from smoking. You need to make sure that you see a trainer in your exercise, you do the exercise correctly, and your weight loss is a gradual process and a monitored one.
So friends, basically for people like me or who are, a little more on the heavier side than me, one thing which we all need to understand is nothing's going to happen overnight, as Dr. Vishal said, as he loves saying that Rome was not built in a day. So your physique would, again, not built in a day. So wherever we see these advertisements like 15 दिन में वजन कम करिए, 15 दिन में 10 किलो कम, बिना exercise के 10 किलो कम. So we have to get rid of all those things, close our eyes on all those advertisements and promotions. It's better to come to a proper consultant who can guide you about your weight loss regime, what is safe for you. Everything, as you mentioned, just by watching YouTube, somebody would have lost like 20 kgs, but we do not know what is their diet. We do not know what is the physiology the person has. There are a lot of other impacts, like factors which impact. So we just see that YouTube video and feel that, okay, if he can do, even I can do, but he may or may not have a hernia, you can develop it. So we need to be a little bit more careful. Obviously, thankfully, I'm not a smoker, but those of our friends who are watching, those who are smokers, constipation is definitely one issue which bothers, which Dr. Vishal very, very rightly mentioned. So Dr. Vishal, thank you for this information. I'll move on to the next question quickly. Now, there have been people who've been asking me further to our previous session that some hernias can heal on their own. So you just push back and the hernia is gone. How real is it? And does it really last long, if at all it happens?
Yes. So going back to the previous session, actually, the way we described and the way we explained that hernia is basically when the room of your abdomen. So imagine yourself, your abdomen as the room that you're sitting in. You have a roof that is broken. Now, that broken roof cannot be, at any cost, cannot be mended with itself or with medication. So yes, the bulge can be pushed back inside on its own, or when you lie down, or with manipulation. But that would be a temporary phenomenon, a temporary thing with which the organ is pushed back into the abdomen. It cannot be a permanent solution whatsoever. Just the way people would ask you, can I push it back inside? I get often asked that, what if now I start doing yoga and hernia, yoga and exercise, would my hernias go away? The answer is no. So once the roof is broken, it's broken for good, and someone needs to repair it. So although it might be very tempting to keep your, pushing your organs back inside all the time, that's not the solution till the time will be one day where there'll be complication.
So very rightly said, if the roof is broken, you need to repair it. So as he gave, you can always go back to our previous session in which he's given some fantastic examples and made things very, very simple for everyone to understand. We'll end the show with a question which everybody would love to know about. If I have a hernia, how do I get it treated? No surgery, an open hernia repair, or a laparoscopic hernia meshplasty, or what now people talk about, robotic hernia surgery. What is your take, if you can just briefly convey a message to our friends?
Oh, sure. So, Himanshu, although it's a very tempting thing for everyone to hear that can my hernia be just left alone and not treated at all? So the answer is, in a very selective group of patients, a wait and watch strategy. Mind you, it is wait and watch. You cannot leave it on its own and things would be okay. Under supervision of a doctor, you may be treated with watchful expectancy and not get operated immediately. So that's one option. And then the other options, as you mentioned, the traditional or the conventional technique of open surgery still holds good. The newer technique are the minimally invasive technique of laparoscopic surgery or robotic surgery, which is the newest thing in the newest kid on the block. Now, these are amazingly good techniques. These are established technologies with amazing results. And I believe this entire topic would deserve a session on its own.
So another thing which we were talking about earlier, which reminds me now that I should put it across to you. Now, when a patient undergoes a surgery, obviously we say that hernia is developed by a patient. It could be because of their physique, ignorance, whatever. When it comes to surgery, how important is the role of a doctor who's operating? I mean, somewhere I would like to put not the blame, but obviously I would like to put the onus on doctor as well when it comes to a patient's hernia being healed or removed or treated.
Oh, absolutely. So you asked a very pertinent question. The hernias that develop after any surgery are known as incisional hernias. They are a very different entity of a hernia as compared to the de novo hernias in the groin or in the umbilicus. Now, all the factors that we just talked of, namely the smoking part, the obesity, doing the right exercises, controlling all your trigger points, they all hold true. But you need to understand that there is a wound that you've given to the patient. That's when I operate a patient. You need to give an optimal environment to that wound so that the healing is good, so that the hernia doesn't happen. Now, this is a potentially preventable hernia, mind you. Rest ones are that God has given you and you can't really much do about it. So what are the three things again that I would like to highlight? Number one, if you are a diabetic, please ensure that your sugars are very good and nicely maintained. Second, if you are on any medications that can interfere with wound healing, you make sure that you discuss this with your surgeon and the dose can be modified. And the third part that needs to be taken care of is there should not be any nutritional deficiencies, and especially any protein deficiency, so that the healing is optimal. And in the last part, infection really causes nasty wound complications. And we know now that infected wounds are very often to develop a hernia. Now, wound care would definitely be domain of the operating surgeon and not just the patient part. So that is where the role of the surgeon comes into picture, that you, whenever you operate a patient, you ensure that the wound is healed well, and as far as possible, give a minimally invasive option, that is a laparoscopic surgery, so that the wounds are smaller and therefore lesser chances of hernia.
Thank you, Dr. Vishal. So friends, it's also a doctor's responsibility. So choose your doctors, choose your surgeon wisely, choose the place where you're getting operated. Hygienic environment is something which he mentioned is extremely important. Keeping a check on your own sugars and other measures which are in your hand has to be very, very well managed. So with this information given by Dr. Vishal, I thank you, Dr. Vishal, for the fantastic information that you've provided in the last 2 sessions we have done. I'll take your leave. Viewers, do keep writing to us, watching our sessions, and do let us know what would you like to hear next from us. Thank you very much. Have a wonderful Valentine's Day to all of you. Thank you, Dr. Vishal.
Thank you. Thank you. Thank you, Himanshu. Thank you so much. Yeah.